the save highlight. Hello. I gotta fix my thing here. Still trying to get more proficient in the YouTube live arena. My head looks really huge. What's up with that? My head looks gigantic. 4 a.m. Okay, hey. Hey, Megan. Hey, Megan. I just found out, Megan, that you can do moderators. So I am just making you one. Uh-oh, am I still here? Okay, I'm still here. What the heck? Thank you, Blossom Kit. I did it. I moderated you. Okay, there's some weird, like, stuff going on here. I'm not used to the YouTube live thing yet. I'll get it, though. I'll get it. I'll figure it out. Oh, look, you can put people in timeouts. How funny. Hi, Diego. Hi, Karen. 4 a.m. Pokey Yapper. Where are you that it's 4 a.m.? Hi, Danielle. Hi, Ollie. Hi, Julia. Is it rational for a 42-year-old who broke 7 ribs in an NVA to get a DNR? It just depends on what's going on. Anybody can have a DNR at any age, but, you know, it kind of depends. Funeral. 1218 here in, is that what is that, Philadelphia? I never want to go through that pain ever again. Oh yeah, I wouldn't blame you for that. So yeah, it's not irrational. If you've been through that and you had broken ribs and you don't want to go through that again, you could certainly make yourself a DNR. Rose milk caught you right before bed. Philadelphia. Okay, that's what I thought. I thought that's what that meant, Philadelphia. So, oh, somebody asked why I'm up, what's up with the late live? I actually was gonna do a live this morning, and I live in Eastern Washington, and I needed to come to Western Washington and had planned on doing that tomorrow, but then we are expecting a big snowstorm. So this morning I made the decision to come over today instead, and it's a good 7-hour drive. And so I wasn't able to do my YouTube live this morning like I planned. Let's see, Richard. Hey, Penny, love your videos. Any advice or tips to avoid burnout or compassion fatigue while working in a hospice setting? You know, I have always felt like in order to do hospice, you really have to have good professional boundaries, good emotional boundaries. You have to remember that you are caring for your patient and their family. It's not about you, it's about them. You're going there to do your job. You really need to not take your work home as much as possible. Professional boundaries meaning that when you're a hospice nurse, you share a bit of your life with your patients. It's kind of normal for you to kind of quid pro quo a little bit, but you don't want to overshare. You don't want to bring too much of your life to your work, because those professional boundaries can get blurred. So I always would ask myself, if I'm going to do this for this person or tell this person this information, am I going to do that for all my patients? And if the answer was no, then there was a boundary issue there. Oh, AJ, are you in Seattle? I'm in Everett right now. Julie put you up to this. I have no question. Just wish people were more tolerant to death with dignity. Vita, Oregon here. Yeah, I wish more people were tolerant to death with dignity as well. I wish it was federally legal instead of just a state by state law. But Julie didn't put me up to this. It's funny. I was doing a live on TikTok. Oh, when was it? I think it was yesterday morning, actually. Man, it's been a long 2 days. And people kept calling me Julie. I'm like, I'm not Julie. I'm Penny. Julie and I are besties. And I guess maybe we look a little alike, but I'm 20 years older than her. So it's a great compliment to me that people think I'm her, but I'm not her. What about a young person who wants DNR solely because of their mental state, like depression, anxiety, so on and so forth? You know, there's nothing wrong with choosing to have a DNR code status. Typically, it's not going to come into play unless there's, some kind of an event that causes a person to not have a heartbeat or a breath anymore. And usually people don't carry their DNR with them. So it's not something where if you filed a DNR code status with your provider and you were out somewhere and you were in a boating accident or a car accident or something else and EMS arrived, they wouldn't know that that's your status. So it wouldn't really even come into play. But if you were going to go through some kind of a procedure and you didn't want to be a full code status, you could choose DNR. But I can tell you most of the time, if you're going to undergo any kind of a surgical procedure, the surgeons want you to have a full code. They don't want you to code. They don't want you to die in their operating table. Yes, me and Julie are besties, absolutely. And Julie and I are actually going to be facilitating a retreat in North Carolina in September 15th, the weekend of September 15th. We're really excited about it. We're going to start advertising for that pretty soon. You'll start seeing us advertising for that on our Instagrams and our Facebooks. So follow us on Instagram and Facebook, Hospice Nurse Julie and Hospice Nurse Penny, on all the socials, and you'll get more information about our retreat. So that's going to be really fun. And I'll be seeing her in April. My parents are in assisted living. Mom is on hospice, and I see the sweet people in memory care who have zero quality of life. They are well cared for, but do not have quality. Yeah, I agree. It's really sad that people that end up in memory care with dementia really don't have much of a quality of life at that stage. It's an insidious, horrible disease. I wish there was a cure for it. Hi, Penny. Is there a way to go about to explain to a person the reality that they are dying and that they won't get better? It hurts to hear my grandma wonder when she will stop hurting, when she won't. Well, first of all, I think most people know that they're dying, even if they don't admit it or say it out loud. I think people do know that they're dying. I like approaching people with questions, open-ended questions like, what do you know about what's going on with you? What has the doctor told you? Is a good way to get a conversation started. Sometimes people avoid talking about the fact that they're dying with their loved ones because they think their loved ones don't want to hear it. So getting the conversation started is a challenge sometimes because nobody's really sure how to broach the subject. But asking questions is always a good way to get a conversation started. Hospice end-of-life caregiver here. Thank you for all you do to educate people regarding hospice care and reality regarding end-of-life process. Thank you, Sherry. Have DNR, have PTSD, depression, etc. Thinking tattoo on my left boob. Yeah, you can do that, but they won't honor it. EMS will not honor that. It's not a legal binding code status to have it tattooed on you because people could get a tattoo and then change their mind. So you could again, it's one of those things where you can have it on file, but if you're out somewhere and something happens to you, nobody's going to know that that exists. Now, when you're a hospice patient, we in Washington State and other states have the same thing, called a POLST, a physician order for life-sustaining treatment. It's a piece of paper that has their wishes on it, and it says like comfort care, no DNR, or I mean, sorry, DNR, comfort care, and it's something they can carry with them. And then because they're expected to have an event like that, they can have this with them. And that way, if something happens, that's there and that can be honored. But a regular person who's in an accident, people aren't going to know that that's there. You're an angel. Thank you, Rob. Not really, but thank you. The capability clause in death with dignity needs to be adjusted, made available to those with dementia. My wife is in home hospice. I'll be here for her forever. So I agree with you totally that I think there's a problem with the way death with dignity works. Because somebody who is no longer, so dementia is a really good example of what happens with people with dementia, is that they they are not within that 6 months prognosis, which is required for death with dignity or medical aid in dying. You have to have a life expectancy of 6 months or less. You have to be certified with a terminal illness with life expectancy of 6 months or less. And by the time a person with dementia gets to that window where they're in the 6 months, they're not decisional anymore. So they are not able to be deemed capable of making the decision for medical aid in dying. So they don't qualify for it. So that is a problem. I wish there was a way that people who have dementia and their early diagnosis could say, when I get to the end stage, I want my family to assist me with this, so that they could exercise the option of death with dignity if they get to that point. What is the difference of the ICU and hospice? So the ICU is for critical care patients, and they're doing everything, and it's in the hospital. It's a unit in the hospital, and they're doing everything that they can to keep alive critical patients and restore them. Hospice is not a place; it's a type of healthcare provider. Although there are hospice houses or hospice care centers where people can go, hospice, generally speaking, in the US, is a type of healthcare, and it's for end of life care. And it's for people who are terminally ill with a life expectancy of 6 months or less. And it's not curative focused at all. It's all about comfort care. It's all about quality of life over quantity of life. What do you think about hospice around little kids? I have 4 kids younger than 8. If I get to this point with myself, from your experience, do children do okay with hospice with the parent? Yeah, so hospice, all hospice agencies are required by Medicare rules to provide grief support services, and most will have children's programs so that they can help with the children's grief, and usually they do that kind of concurrently while the person is on hospice. I think having hospice involved is imperative if you're a mom with kids or a dad with kids, and you have a terminal illness. I think it's imperative to have hospice on board, because they're going to be able to help provide the kind of grief support that children need and the kind of education that they need to understand what's happening. I always think it's better for a person with children to be able to die in their own home with their children. Oops, just a second. Yeah?
It's really cold these nights. Do you want a little heater out of their room or extra blanket? Well, they're in if you need it later, they're in that room,
Okay,
the girls' room.
okay,
Okay?
okay. That was my mom. I'm at my mom's house. She wants to make sure I'm warm enough, because even though I'm 60 years old, mommy has to take care of her daughter. Okay, I'm scrolling back here. Anyway, as I was saying, I think it's really important for people who are terminally ill, who have children still at home, for that person to be able to be in their home through the end of their life versus going into the facility or even worse, into the hospital. Because children need to have access to their parent when they're dying. And if the person is dying in a facility, then the children rely on visiting hours and they rely on adults to take them there to visit. Whereas if the parent is at home, the children can, go climb in bed for a snuggle any old time they want to. They're not limited to when they get to see their parents. So I think hospice at home is ideal if there are children involved. There is a line early on in the law in Oregon states ability of capability, as you say, exactly the adjustment that needs to be made, placed in the post, maybe an advanced directive. Yeah, that's what I think too, in an advanced directive, that they could state that they wanted to be able to exercise that. In 4th month hospice, again, lost appetite, given 2 meals, Dexa, 8 to prevent constipation, had warm prune juice with lactulose, now have painful gas, tummy pain. Are you in hospice? I miss my great grandmother so much. Oh, yeah. We always miss our people that die. We always miss them. We never stop grieving. We just learn to live with the grief. How do you comfort kids that go to the hospice when they know that they are really sick? I am not a pediatric hospice nurse. Generally, kids do pretty well on hospice, though. That's what I know from my colleagues. They almost seem to have a better understanding and acceptance of it. My mom is nice. She's nice. She's great. Who determines how much pain meds are given? The physician, the hospice doctor, makes the orders for the pain medications. So we don't just give them willy-nilly. We have an order for how much we can give. The nurse will be in contact with the provider if the medications aren't working, and we'll get an order to increase them. But it's a doctor that writes the orders for the medications. I have never worked with a death doula. When I first got on TikTok and I started hearing about death doulas, and people would ask me that, and I would say, I don't know what their point is. Like, they don't get reimbursed by insurance, and what do they do that the hospice team doesn't do? And then I started learning more about them. There's a big community of death doulas on Instagram, and I started getting a better understanding of what they do. And I think they're wonderful. Unfortunately, they don't get paid by insurance. It's not reimbursable. It's a private pay thing. I know that some people will do it on a sliding scale. And I think they're a wonderful addition to the hospice team if a family can afford to hire them. I always say the example I use for how a death doula can work with the hospice team is, the social worker will often provide a list of funeral homes to the family and the patient, and they might give them some tips on what questions to ask. They'll give them the information for Social Security. This is what you're going to have to do after your person dies for Social Security, to take care of Social Security stuff. The death doula can take the time to actually sit down and pick up the phone and make a phone call and call the funeral home and help them with these things, help them write the obituary, help them do these things. They have more dedicated time for that family because they're usually only seeing one family at a time, whereas a social worker might have, easily a social worker could have 30 patients on their caseload, easily, or more. How long are patients usually in hospice? So the average length of stay right now, I think, is 72 days. So people can be on hospice as long as they are considered to be terminally ill with a life expectancy of 6 months or less. If they outlive 6 months, then we don't boot them off of hospice. We have a recertification process. So at any given time, as long as they meet that criteria of a life expectancy of 6 months or less, they can stay on hospice. Sometimes people come on hospice and they die the same day. unfortunately. It's awful, but it happens. And sometimes they're on hospice for longer than 6 months. I've seen people be on hospice for a year, 2 years, 3 years, even 5 years, and that's pretty rare. But they can outlive that 6 months. Will C. diff kill you? I do not think that C. diff can kill you, but it can make you really sick. If somebody is really compromised, like they're on hospice, I think it can contribute to your death, but I don't think by itself that it can kill you. It could though. I mean, because C. diff causes um, diarrhea, like massive diarrhea, so you could get extremely dehydrated and die from that. Absolutely. Thank you for this answer. I needed this confirmation. Your videos really help appreciate this. Thank you. Thanks for saying that. Yes, in hospice, that is 2 milligram dexamethasone. Stomach pain and gas is painful. Any suggestions to relieve pain? I think you should talk to your hospice provider. I can't really give you any medical advice. I don't know anything about what's going on with you. I don't know your diagnosis, the other meds that you're taking. But definitely if you're really having a lot of stomach pain and lots of gas, you should probably be talking to your provider because they might need to make a medication adjustment. Oh, Kathy used to work for hospice? Cool. One hospice test for how long or availability is the FAST test? Google FAST test. My wife is 7B and home hospice has been for 3 months. Yeah, the FAST is the functional assessment staging tool. That's for dementia patients. And they have to be a 7, I want to say a 7 or higher to be able to qualify for hospice. Yes, thank you, Megan, Megan, I'm not used to seeing Megan on here instead of Crazy Kitty. Yeah, follow me on my other socials, everyone. I'm on TikTok, Facebook, Instagram. Hospice Nurse Penny is my username on all of them. My Facebook page was hacked back in December, and Facebook restored it to me after 6 months, but now I no longer have access and they can't fix it, so I finally just started a new one. So it's Hospice Nurse Penny on Facebook. And I had 21,000 followers on that account, and it's still there, and it still has the shitty videos that the hackers put on it, but I have no access to it, so I have a new one. It warms my heart you are helping normalize that it's okay to talk about death and end-of-life care. Unfortunately, it's still a taboo subject that makes a lot of people uncomfortable. Yeah, it totally is. And I think it's really important to normalize it for a couple of reasons. One, I've been with so many family members of people who were dying, who were terrified when they saw their person doing things that they had never seen a person doing before because they hadn't been around dying. And so it was scary for them. And when I would say to them, oh, that's normal, that we see that all the time, that's a normal part of the dying process, the relief was palpable. Like they were just, it's normal. Yeah, it's normal. We see it all the time. And it just really helps people feel better about what their person is going through. So that was my experience as a hospice nurse. And as a human, I suffered from death anxiety when I was in my 30s. It was crippling. I couldn't sleep at night. I had fear around, everything to do with death. And I realized that the more that we talk about it and the more that we know about it, the less unknown it is. And, we normally are going to fear things that are unknown to us. So if we can learn about it, talk about it, then it can help that death anxiety be alleviated. I have one more question. How do you personally cope with hard days? What you do is beautiful and necessary, but it can't always be easy. Is there anything that brings you peace in those darker times? So first of all, I don't do direct patient care anymore. I am a hospice quality nurse, so I am partially retired and I work from home, from my cabin, actually, where I live. I'm not there right now, but so I don't do the work anymore. But doing bedside work, which I did for many, many, many years, I had some times that were a little bit challenging and I'd have to take a mental health day, but for the most part, I never really felt overly sad or burned out. The only reason that I stepped away from doing bedside care was I was burned out from the commute. I lived in Tacoma and I worked in the Seattle area where traffic is really, really hard and horrific. And an opportunity came up in quality, and I was ready to kind of expand my horizons within hospice. I always like to learn as much as I can about whatever I'm doing. And I had worked in inpatient hospice and I had worked in home hospice, and I felt like I needed to expand my knowledge base and wanted to go into quality. And this opportunity came up where I could work from home. And that's the reason why I stepped away from the bedside. But I never really felt that it was hard to cope. I just didn't. Have you thought of collaborating with Ask a Mortician? I love how gentle and calm this stream is. Thank you so much. Ask a Mortician is famous. I mean, that's Caitlin Doty, right? Or Doherty? Caitlin is Ask a Mortician, and she's like got millions of followers. She doesn't know who I am. I would love to collaborate with her, absolutely. I think she's fantastic. I've seen lots of her videos, and I love her 1,000,000%. I would love to collaborate with her, but she does not know who I am. Aw, thank you for all the information on morphine. You gave me the courage and confidence to administer morphine and Ativan in the last few days of my grand's life. Oh, thank you, Terry, for saying that. I'm so happy to know that. I am so happy to know that was helpful to you. People are really afraid of giving those medications. They're so afraid that they're going to cause a person to die, and they're not. It's especially hard when you're the one that just gave the last dose, because it feels like you are the one who caused their death, but you didn't, because there's always going to be a last dose. There's always going to be a last dose of medication. And as a nurse, when I first started working in hospice, I remember being the one to do an IV push of morphine or Dilaudid or fentanyl, and shortly after the person would die. And it is kind of unnerving. It does feel like, ugh, did I just do that? But no, the people are dying already, and you're just giving them the medication to make sure that they're comfortable. It's not causing them to die. I am a nurse's aide, personal support worker, as we call it in Canada. I specialize in palliative care. I've held the hands of many people who passed away without any family. Oh, Diane, that's so nice to know. I know in Canada, it's not really called hospice, it's called palliative care. And we have palliative care in the US too, but it's different than hospice. I hope that a time comes soon that will increase the knowledge of the care package used in hospice. Amazing how little is known about comfort drugs at end of life. Hope knowledge becomes exponential. Yeah, the comfort kit or the e-kit or the emergency kit or the rescue meds. Those are the meds that we like to make sure that people have in their home. It's kind of hard to find those drugs in the middle of the night if your person's dying and they suddenly need them. And so we definitely want to make sure that those medications are available. And they're pretty well standard across the US in hospices. Most hospices use the same medications or similar, at least the same class of medications. So morphine, Ativan, something to dry secretions up, which don't work very well, and I hate them. And haloperidol, which is an antipsychotic that we use for a number of different things. But those are the rescue meds, and they're safe and they help people at the end of their life to be comfortable. I work in LTACH, and that's great to know. Was LTACH, is that long-term care? My husband of 44 years passed at home December 5th, 2022. Recently, of prostate cancer. Working with hospice was helpful. We have a two-story, and right away they expressed that his bed was going to have to come downstairs. Yeah, I always like to have people think about putting the bed in the living room, because they're able to, be kind of in the center of the house where there's going to be activity and people can visit more easily. With everything you have seen and experienced, do you now 100% believe in an afterlife? And do other hospice nurses talk about this topic with each other? Oh, yeah, we talk about it all the time with each other. And yes, I 100% do believe in an afterlife. Absolutely. And yes, my colleagues and I talk about it all the time. We see people visioning at the end of life. We see them reaching up, looking to the ceiling, looking in the corner, talking about seeing their deceased loved ones and pets. And it just definitely gives you the sense that they really do see spirits. And for me and for many of my colleagues, kind of confirms an afterlife of some kind. What should be used to dry secretions? I really don't like to use medications for those secretions for the death rattle. I find that the medications don't work really well, and because they're meant to dry secretions, they dry all the secretions. So people get a very, very dry mouth when you use those medications. First of all, the death rattle is not harmful to the person who has it, it's just a noise. And education to the family that it's just a noise, they're not going to drown in those secretions, it's not harming them at all. But the thing that works best is to put the head of the bed up and then to put them onto their side. And then that can help those secretions to kind of settle down and not be so bad. So many people think we are starving them. Yes, so many people do think that we're starving them, and we are not. We don't tell people that they can't eat. We just tell families not to force their person to eat. Give them what they want, as much or as little as they want, whenever they want it. People are not hungry at the end of life. One of the earliest things that starts to happen as a person is dying is that they lose their appetite because the body's shutting down, and it's going to slow down digestion. That's one of the first things that starts to go in the body as it's shutting down is digestion. They don't need to eat anymore. They don't need the nutrition. They don't need the calories. And so they're not hungry. But we don't starve them. We don't say don't eat. We just say don't force a person to eat. Don't coerce them to eat. Give them what they want. I start clinicals Monday at JBLM. Do you have Joint Base Lewis McCord? Do you have any, is that Joint Base Lewis McCord? Do you have any tricks to prevent Freudian slips, like jokes that are really funny in your head but completely inappropriate in the clinical? Just, I don't know. Just don't do it. I don't know. I don't know what to tell you. Keep them in your head. Don't let them come out of your mouth. I wished I had found your channel before my dad passed away. I would have known more about what to expect instead of freaking out over everything. Aw, yes. That's the thing. We don't want people to freak out. We want them to know what to expect. However, we let them know that we had a hoist carrier. I borrowed one from Mayo and carried him down for his continued journey. They were shocked and loved it. I found you in his last 2 months. Oh, I'm so glad. Megan, I see you timed somebody out and deleted their comment. Interesting. Interesting to know what kind of things are different on the YouTube live in the way of moderation. Let's see. Hey, Fun with Fidgets, hello. Oops. I kind of see the comments have stopped, and I don't know if they're there's a delay like there is on TikTok, or if everybody's just very quiet now. Timeout, yeah. I like timeout. I mean, they have timeout on TikTok too. It's called muting. Oh, there's a delay. Oh. Oh, thank you, Annabella. Annabella Brooke, thank you. I'm drinking water while watching this. I'm drinking water too. Cheers. Cheers. Now, just now stumbled in what you all talking about. We are talking about death and dying. We're talking about hospice. Is it common to feel guilty about the death of someone you witness having an event leading to their death? Is it common to feel guilty about the death of someone you witness having an event leading to the... I don't quite know what you mean by that. I'm not sure what you mean by that. What kind of an event? Why is Megan's name Blue? Because Megan is a moderator. My day was good, thank you. I spent most of it driving. My day went a little sideways on me today. I really had planned on a totally different day than what it ended up being. I was going to work on my book this morning. I was going to do a YouTube live this morning. I was going to record a bunch of TikToks. And then all of a sudden, we woke up this morning and my husband said, oh, look, there's a snowstorm coming. It's going to start snowing and it's going to snow for the next 5 days. And I have a doctor appointment on Thursday in Western Washington, and I live in Eastern Washington. And I didn't want to get stuck over there and not make my appointment. So I made the decision to jump in the car and drive over here. It's a long drive. It's a 6.5 hour drive. So I didn't get to do half of what I was going to do this morning. I know this is off subject, but I recently broke both of my wrists in a 4-wheeler accident. LOL. That doesn't sound like an LOL. That doesn't sound funny. So what about a hospice volunteer? Julie mentioned that. I thought of it. I just don't know. Thinking after my wife passes, Care Blazers have taught me so much. So hospice is required by Medicare to use 5% of their services by volunteers. Like we're required to use, it's the only healthcare service in the US that's a Medicare benefit that requires that we utilize volunteers. So we're always looking for volunteers. I will tell you that most hospice agencies don't like to have people volunteer if they've recently experienced the death of their person. They usually like people to wait for a year until after the death of their person because it hits too close to home. But it's easy to find a hospice agency to volunteer for. You just need to go to the Medicare Compare website and put in your zip code and choose hospice, and it will bring up any hospice agencies in your area. And then you can just call them and ask them about their volunteer program. Have you ever had a deceased patient visit you? My father went to my neighbor and told him that he couldn't find his way home because he had his glasses. Then I remembered I had it in my backpack. I've never had a deceased patient visit me. People ask me that sometimes, but they have family and friends, so it wouldn't make sense for them to visit me. You know, when we're hospice teams are only with our patients for a window of time. You know, we're just a little tiny part of their life, and it's an important part, and we can get very bonded, and they can bond to us. But in the overall big picture, you know, we're just a little part of their life, and so it would surprise me to have any of my patients ever visit me after their death. My dad visited me after his death, but I've never had a patient. I've had dreams about my patients, though. Oh, I was on vacation with my family, including my grandparents. My grandfather fell over on the second day but seemed fine. We asked him questions and he responded with the usual jokes. He had an intracranial aneurysm and died 3 days later. My great grandmother followed 17 hours later. I feel guilty and that I could have done something to prevent his death, even though I know that there was nothing I could do. There was nothing you could do. You're absolutely right about that. An aneurysm, there's nothing you could have done about that. That wasn't preventable. Have to go. Time for ice cream. Meds for my wife. Thank you for your time, Penny. Thank you, Mike. Thank you very much. Go take care of your wife. Maybe a weird question, but when someone does die, is the family allowed to keep the body at home for a period of time? Is there a law surrounding this? That's a really great question. Each state is going to have different laws, but typically there isn't like really strict rule about it, but you don't really want to keep somebody in your house for a long time because they are going to start to decompose. But I know that some people do like have at-home funerals, and usually when they do that, they get a funeral home involved. But I know that at one point I had a patient who was, I can't remember what the religion was, but they kept the body in the home for 3 days. Like that was their religious practice. And so they were allowed to do it. The doctor said she wants to recommend my mom to hospice, but my mom doesn't fully understand. She doesn't feel anything is wrong. How do I help her understand and agree to hospice? Well, first of all, you need to ask her what she understands about hospice and then help her to understand what it is that she doesn't understand. The doctor should be able to help you have that conversation, and if not, hospice can. What I would do is try to ask her what she understands about hospice, and let her know, like a lot of people think that it's giving up hope, and it's not. It's about changing what hope looks like, and that they're going to bring more help into the home and help for the family. And then you can get the hospice liaison, to come and talk with her about it too. I have a quick question. Do old people die if they drink a lot of alcohol, or like their sugar blood is too high? Because my grandpa passed away in 2020. I don't know if it's about the blood. I mean, people can die from drinking too much alcohol, old or young. Thank you for your content. It really has helped me deal with loss, and it certainly doesn't hurt that you are so funny. Thanks, Ashley. I like to be funny. I like to lighten up the subject of death. Death is a dark subject, and I want to talk about it, and I want to educate about it, and I want to normalize it, but I know for some people it's hard, and so I like to lighten it up a little bit. Sometimes I think like doing a really quick little funny video to try to get the point across is a great way to give people the information in a little digestible chunk. When my mother was dying and having more pain, I asked the doctor via phone if I could increase morphine. He said, sure, if you wasn't, oh, there's some that got cut off. Oh, you blocked my favorite keyword. Oh, thank you. Thank you, Megan. I know which word that is. Annabella, thank you so much. I'm glad you like my hair. Does the death gasp hurt if they are in ICU and have benzos? It is horrifying to watch. Oh, Zolanda, save. Happy birthday. So the gasping that people have at the end of life does not hurt. It's normal. It's very normal. It happens to most people who die a natural death. This is when they're just really pulling on air and not moving a lot of air. But that's a normal breathing pattern, to just kind of pull on air like that. And the reason why we know that it doesn't hurt them is because their face is typically very relaxed when this is happening. So we can tell if a person who's unresponsive is uncomfortable by how their face looks. If they're uncomfortable, they're usually going to be furrowed right here, especially like creased up. But if they're relaxed, then they're usually not hurting or uncomfortable at all. This happened to my great-grandmother in a different city. We would go to her in her house and visit her, but one day she died, and my aunt told me that she died in her room. Thanks, you guys, for the compliments on my hair. There's a delay on the questions again. I don't like that. TikTok used to be like that. Mom is in stage 4 chronic kidney failure. In January, her hemoglobin was 5.5. Do you have a time frame approximately? There's way more information that's needed to be able to even venture a guess in a time frame. It's best to talk with the doctor, or if she's on hospice, the hospice nurse usually has a better picture than the doctor does. But it's impossible to really say with this much information. There's got to be more information than that. I found comfort in your content after a friend who was dying of pancreatic cancer and chose to end his life on his own terms here in Eastern Oregon. Thanks for the laughs and education. Thank you, Olive. Thank you. Thanks for reading our questions. Really enjoyed your interview on embracing death. Have you ever treated someone in hospice that was a former nurse? Yes, I have. I have. And boy, the one that comes to mind was a nurse in the Harborview burn unit. She got cancer, and she felt like she probably got cancer from the chemicals that they use in the burn unit. And it was really sad. She was a young woman. She was in her, I want to say she was in her late 40s or early 50s. And her daughter was off at college. And I'll never forget calling her daughter. And her daughter, it was like November, I believe. And her daughter said she wasn't planning on coming home until Christmas break. And I said, I think if you want to see your mom alive, you have to come before that, because I think she's not going to live that long. And if she does, I don't know that she's going to be awake when you get here. Because when people are dying, they get to a place where they're unresponsive. So if I say I think that somebody has 3 weeks left, they're not going to be awake that whole 3 weeks. They're going to be like sleeping more and more and more until they're unresponsive. So it's important to come sooner than later when your person is dying. So that was a hard conversation. I think I'm going to sign off, guys. But thank you so much for joining me. If you haven't subscribed to my YouTube channel, please make sure that you do that. And also follow me on the other socials, Instagram, YouTube. Oh, I'm on YouTube right now. Instagram, TikTok, and Facebook, Hospice Nurse Penny on all of them. So thank you so much. I might just hop on over to TikTok for a few. So thanks for joining me, guys.